Good morning, everyone. Welcome to our Facebook Live session. This is Eladio Pereira, the Chief Medical Officer of the Mariposa Community Health Center here in Nogales, Arizona. With me, my esteemed colleague, Dr. Phil Williams. Welcome, Dr. Williams.
Thank you so much.
And as you know, this is a session we do for our community engagement in terms of providing information that we hope is useful to you. And today is about the influenza vaccine and the other respiratory vaccines that we have available to reduce the risk of infection and the risk of complications. It's November the 5th, and it's fairly cold where we are. It's in the low 30s, and we're reminded that it's important to reduce the risk of infections to keep ourselves healthy. Always a reminder that these infections are spread by a breath, and that in some cases, perhaps the infection may not be as severe with us, who might be a little younger. But for those who are very young, infants or older, over 65 or 70, that the disease can be very, very severe. So we want to speak first about influenza and the vaccine. We know that influenza is a viral illness caused by the influenza virus, A, B, and C. And in some cases, it can be very severe. The illness typically starts very abruptly with the onset of cough, fever, very significant muscle ache, sore throat, and of course, general malaise, in some cases, very high fever. We do have treatment available when the infection is diagnosed early, but the most important preventive measure is the vaccine. And the vaccine is available for those 6 months of age and older. There are various forms. We're going to discuss that today, except that typically for patients 65 and older, the high dose is recommended. There are other forms available. You check with your healthcare provider. Dr. Williams is a pediatrician, and we want to emphasize the importance of the flu vaccine in children, right, Dr. Williams?
No, of course. Thanks so much for talking about this important topic. As you know, flu season is about to hit this area. We haven't seen a huge increase in the number of cases now, but we expect really at any point we could start to see increasing cases. And it's important in everyone, but especially in pediatrics. They're a very, very, very vulnerable age group. And as you mentioned, it can be given 6 months above and older, really to all kids. Just a reminder that for those kids that get their first dose, for the little babies, they actually get 2 doses. As opposed to others who will just get 1 dose for older kids. But it's important not only for kids that have chronic health issues like influenza, kids that were born premature, that may have something called chronic lung disease. We have a small subset of kids here that have other lung issues like cystic fibrosis and other things. But definitely in that age group, then it's necessary, but really for everyone, just because, as you know, the flu virus changes every year. So there's something called antigenic shift and drift. So there's mild modifications in the flu virus. So they specifically target this vaccine to target some of the new flu strains.
And this year, the influenza is a trivalent vaccine. It contains 3 kinds of strains. It's also important to remember that while the vaccine reduces the risk of infection, at the same time, it reduces the risk of complications after the infection. And sometimes we fail to recognize that post-influenza can be a very vulnerable period. We know that bacterial infections tend to occur a few weeks after initial infection, and we see the classic bibasic infection where the initial infection occurs with influenza. It treated, and then 2-3 weeks later, the onset of cough and fever, and that's a bacterial infection perhaps because the immune system was affected by the initial infection. And now we have to treat that. So a quick reminder that bacterial infections can happen, and in children the same thing too, right?
Correct, exactly.
Yeah. Typically streptococcus pneumonia, but the other more significant bacterial infections such as Staphylococcus aureus can also occur. So keep in mind that, yes, we're worried about the initial infection, but the post-influenza syndromes can occur, and we do recommend the influenza vaccine for those patients 6 months and older, those who are vulnerable, and of course those who are 65 and older. The COVID vaccine is available. It's recommended that we administer the COVID vaccine at the same time we administer influenza, right, Dr. Wheeler?
Correct, exactly. Exactly the same time. It can also be given age 6 months and above.
Right, and so for certain groups, 2 doses are recommended, right?
Correct. October 23rd, the CDC director came out with a new recommendation that for this year's COVID dose, if you're 65 and older, or if you're in that vulnerable age group, so people with certain medical conditions, people that are immunocompromised, they'll actually get a second COVID dose 6 months after this initial.
And we know that the vaccine can reduce the risk of severe disease. It can reduce the risk of hospitalizations and the risk of death. And again, in certain groups, maybe the disease cannot be very severe, but those around us can be significantly affected and end up in the hospital, have a very, very severe disease. There are other vaccines that we administer to reduce the risk of respiratory infections. One of them is a vaccine that can offer protection against whooping cough or pertussis, and that's the Tdap. We've seen a few cases of pertussis in our community, right?
We have, yeah. I mean, it's if you have never seen pertussis, it can be very, very severe. Had a few different kids that were hospitalized due to severe pertussis. So, good news, there is prevention.
Right, and we've seen cases of pertussis even those vaccinated. Usually, we want to vaccinate every 10 years, but we've seen cases when the vaccine was given 7, 8, 9 years ago, and now they acquired the infection. We get suspicious when the cough lasts longer than 2 weeks. It could be other things, but every time the cough lasts longer than 2 weeks, we want to test for pertussis.
And it's so contagious. It's one of those things that we provide what's called prophylactic treatment, where if you've been exposed, then you're probably going to need antibiotics.
Even if you were vaccinated. And so people in the household or people at work who were with that individual will need essentially antibiotics to prevent the acquisition of the infection, or at least reduce the risk of more significant disease. And then there are others. Pneumonia vaccine is available. Check with your healthcare provider about getting typically PCV20. Other are available, but we use an app to make that determination what is the best vaccine available for you. But pneumonia vaccine, and then RSV, respiratory syncytial virus, common in older patients, but in children, very common, right, Dr. Wheeler?
Yeah, very, very common. The most common cause of hospitalization in kids under a year. So there's various vaccine options for older adults, also for pregnant women, 32 to 36 weeks. And then a newer option that we have, our second year, we have a treatment option. It's called a monoclonal antibody, but it's another treatment that we can give kids up until 8 months, that we recommend that every single kid does receive that.
And of course, influenza vaccine is recommended for pregnant women. Also, Tdap is recommended for pregnant women. So those are very, very important vaccines available. Check with your healthcare provider. COVID also. We want to get into the pregnancy, but we do have providers that can help us with that. But generally speaking, those are vaccines that are available to reduce the risk. And it's important to protect each other. These illnesses affect all of us. One can affect 10, 20 people, and we can do more. We have a responsibility to protect ourselves, but also to protect the ones who surround us, particularly those who are vulnerable, our grandparents, family members who may be immunosuppressed, undergoing cancer treatment. So we hope that you get vaccinated if you're eligible for the vaccine. So a reminder, get your flu vaccine, ask about COVID and other vaccine that you may be eligible for, and we're here to answer any questions if you have them. Mm-hmm. With that, I think we're going to end the transmission. Thank you, Dr. Williams, for being here today. Thank you, Marco and Edgardo Mariposa, for facilitating all of this. See you the next time. Thank you very much.